Hello everybody, welcome to my YouTube channel, Homeopathic Super Sessions by Dr. Charkos. Today, I'll be shooting a short video in which I'll tell you an important remedy for allergic rhinitis. As you all know, allergic rhinitis sounds simple, but it may be difficult to treat, and at times you do not get the appropriate or the desired results. In spite of your best efforts, take the case completely, find out the acute remedy, the constitutional remedy, and also the intercurrent remedy. However, it may so happen that in your practice, a few cases you are unsuccessful in treating allergic rhinitis. Well, so today I'll be telling you an important remedy which in my practice since the last 35 years, I have used it with exceptionally good results. Especially in those cases in which also I have failed or not gained the desired results. So always think of the remedy ammonium phosphoricum. I repeat, ammonium phosphoricum. It is an important remedy wherein, in spite of your best efforts, all the other remedies, what you have given, they have failed or they have not given the desired result. In ammonium phosphoricum, or commonly known as ammonium phos in short, the symptoms are there that the patient will tell you that moment he gets up in the morning, there is sneezing around 10 to 15 or sometimes even 20 times. So the amount of sneezing occurs in the morning as soon as he gets up from the bed is around 10 to 20 sneezes. And the remaining part of the day, it is much less or it is not there at all. So if this symptom is present, which is again a common symptom of allergic rhinitis, so when a common symptom is intensified or the patient goes on telling you repeatedly about the same thing again and again, a common symptom becomes a characteristic symptom. So we are taking this symptom, a common symptom, because the patient has again and again, he's telling us the same thing that moment I get up in the morning, I get a bout of sneezing around 10 to 20 times. So I repeat, a common symptoms becomes characteristic whenever the patient always goes on stressing on the same symptom over and over again during the interview. So please try this remedy, ammonium phosphoricum. The dosage is that you can give it in the centesimal potency, start with 200, 3 times a day. Always a repeat, give a wet dose. That means in half cup of water, dissolve 4 tablets and give it 3 times a day. If the patient improves, then gradually you shift over to the 1 m potency, again 3 times a day. Now, repetition out here is important because in allergic rhinitis, the triggering factors are quite common and they will also aggravate the condition. So these triggering factors act as a blockage or a you can say it acts as a maintaining cause to maintain the disease. So if we only give 1 or 2 doses, it will not be sufficient. You have to repeatedly stimulate the vital force so that the cure will take place. So in my experience with ammonium phos, it at least takes 3 to 4 months for the patient to have an appreciable effect on the allergic rhinitis. So initially start off with 200 potency TDS, give a wet dose. If improvement takes place, then you go on to the higher potency 1 m TDS for a period of 3 to 6 months. And you can see the results for yourself. Well, please try this remedy and be successful in the practice. If you have any comments, please, or any queries, please write in the comments. I'll be happy to answer them. Thank you.